I'm Dr. Sachin Jadhav. I'm the group head for hematology and bone marrow transplant for HCG group of hospitals. I'm also the chairman for the International Hematology Consortium. When we look at cancer and the treatment of cancer, there have been phenomenal advances in the last 20, 30 years. As a result of which, we are able to save many more lives, we are able to cure many more patients. But what are these advances? If we try to categorize, there are two kinds of advances that we can think of. One, we have a far better understanding of cancer, what causes it, and which kind of patients need more treatment and which patients need less treatment. And this first kind of research is about the genomics of the cancer cell. The second kind of research is in understanding what are the different kinds of complications which happen during treatment of cancer and how to manage these complications better so that the treatment does not cause more harm than the disease. We understand that our cells have DNA, those are the genes, and genes are the software on which our cells run, on which our bodies run. When this software gets defective, when the genes get mutated, some patients can get cancer. And understanding of these genomic problems which lead to cancer has been greatly accelerated because of newer techniques, one of which is called as OGM, optical genome mapping. It's a new technique of looking at the so-called mutations, the defects in the DNA, and we've recently concluded a clinical trial, a research trial, which actually tells us what are the different kinds of these genomic abnormalities which cause this. Now that's the improvement in technology, which is giving us more information. In terms of figuring out how to better manage side effects of cancer treatment, we have better medicines which can deal with infections. We've again completed one more clinical trial where we are trying to figure out how do we treat patients who get infections with bacteria that are resistant to routine drugs. Resistant infections which do not respond to routine antibiotics. And we've just completed a trial with newer medicines such as ceftazidime, avibactam, aztreonam, and that tells us that we have to have newer innovator medicines, drugs which can actually treat resistant infections. It's important to do scientific research, whether it is genomic or medical, in a safe regulatory environment. We need regulation, we need oversight to ensure that we are doing research and understanding it, implementing it in a sensible manner. We have to be sure that if I find a mutation in a patient, that it is really going to help the treatment of that patient and not just lead to anxiety. And I think that is where is the art of medicine. Science is one thing. Science tells, look, this is the information, take it or leave it. In my mind, the art of medicine involves interpreting and in a humane manner ensuring that we use what is necessary to achieve cure and do not dwell too much upon what everything else that we are finding, which may actually not be relevant and cause undue anxiety and worries to the patient and the family. Today I want to tell you that not all cancers are the same. There are two particular so-called blood cancers, CLL and follicular lymphoma. These two blood cancers are very slowly growing and may not even affect somebody's bodies. So when we diagnose one of these two, either CLL or follicular lymphoma in a patient, the first thing that we have to do is one, is the diagnosis correct? And two, how advanced is this disease? Is it really affecting the patient's body? Does this patient truly need treatment? Or would the treatment cause more harm than good. Remember, CLL and follicular lymphoma, in some patients, not all, in some patients, can be dealt with, lived with, even without treatment for a few years, provided that disease is not affecting your body. When it comes to my specialty, hematology and bone marrow transplant, it's a new specialty. We don't have so many trained doctors, we don't have departments, teams which treat patients with blood disorders available all around the country or even in a lot of the other countries which are part of the developing world. We have worked very hard over the last 10 years to build multiple centers where blood cancers can be treated, where bone marrow transplantation can be done. In fact, in the last 10 years, our team has built 13 bone marrow transplant centers, 12 in India, 1 in Africa. We're very proud to say that we have improved access to high quality treatment. And that's the second bit. The second bit is high quality treatment. What do we mean by high quality treatment? In a nutshell, if I have a patient whom we are treating for blood cancer or who is going through a bone marrow or a stem cell transplant, the patient's family should not feel that if I had money, I would have taken my father or brother or sister to US and treated. Maybe then my father would have survived. Maybe then my brother would have had a better chance of cure. I believe that it's our responsibility to give the same chance of success to every patient in our country. And that, in my mind, is quality of care. So, how do we build quality of care? Sure, we built 12, 13 transplant centers, but are they doing a good job? Are the doctors, nurses, rest of the hospital staff working as a team? Are we working with protocols, processes, with quality management? Managing infections, managing complications at such a high level that the chances of success or failure are the same that a patient would experience in UK or US or Canada. So, the way forward for hematology and bone marrow transplant is to build more and more centers which provide treatment, and the quality of treatment, the chance of success is equal to the best centers in the world.